Good morning, everyone. This is Dr. Vinay Saranga, owner of North Carolina Institute of Advanced Neurohealth in Apex in Fuquay Varina, North Carolina. I'm a child, adolescent, adult psychiatrist. And just wanted to spend a few minutes this morning talking to you about some less commonly known signs that someone may be suicidal. Okay, this is September is Suicide Prevention Month, so I think it's always important to think about suicide, or if you're concerned about a loved one maybe suicidal. But especially this month, just in honor of that, I thought it'd be a good opportunity to kind of discuss some of these signs, because as many of you know, this is more of a personal concern of mine due to a recent loss we had in my family less than a year ago. So I want to increase awareness about these signs because they're extremely important to try to recognize these. And if you have a family member or a loved one or friend who you're worried about may be having suicidal thoughts or severely depressed, please call 911. Take them to ER. Call 988, the suicide hotline. Get them to a safe place. We don't want them to hurt themselves or hurt anybody else. But here are just a few things that to keep in mind that are maybe less commonly known or less easy to recognize in someone who may be severely depressed or suicidal. One to keep in mind is risk taking that feels out of character. So if they're starting to engage in some reckless driving, gambling, substance use, alcohol, drugs, or any other dangerous, perhaps even like unusual sexual behaviors, risky sexual behaviors, for example, that are unusual for them, that can be concerning. So any unusual behavior overall for your friend or loved one. So something else to keep in mind, if they're making hidden goodbyes. So for example, if they're writing long letters, posting reflective or farewell-like messages online, or reaching out unexpectedly to people from their past. Also, if they're fixating on being a burden, if they're repeatedly saying things like "you'd be better off without me" or apologizing excessively, that can be concerning too. And also, for something else to keep in mind, as far as a concern that someone may be suicidal, is if there's sudden improvement in mood after receiving bad news. Because sometimes that can be mistaken for recovery, but this may indicate they've decided on perhaps using suicide as an escape from the pain of life, unfortunately. So, and lastly, if they've kind of starting to become obsessed with getting their affairs in order, if they're unexpectedly creating a will, paying off debts, tidying up personal matters when it doesn't seem necessary, that can be concerning as well. So hopefully, I hope these kind of thoughts, tips, signs were useful to you. Once again, if you're recognizing any of these symptoms or signs in a friend or loved one, please reach out for help, get them to a safe place, so they can get the help they need. All right, take care and have a good day. Bye.